Natural disaster, conflict and extreme poverty have made getting even the basics of life challenging for millions of Pakistani families. In Basti Kurayan village in Sindh province, the effects of last year's devastating floods can still be seen and felt, especially by women and girls. The villagers were among more than 14 million people who urgently needed safe water and basic sanitation following the worst monsoon floods in Pakistan's recorded history. The government of Japan contributed $9 million, helping 835,000 children and adults so far with life-saving water, sanitation and hygiene in flood and conflict-affected areas.
We had contaminated water in our water pumps before the floods. After the floods, the water became more contaminated and the water was not safe for drinking. Everybody had diseases. UNICEF came here and installed a new water pump for drinkable water. Now we bathe and wash very well. The whole village is happy now due to the water pump.
The people of Punjab province, who also suffered the ravages of flooding, are among the vulnerable benefiting from Japan's focus on improving the health of Pakistani mothers and children. This basic healthcare centre in Haji Gaji village now has a labour room and up-to-date equipment that ensures safe delivery. Newborn delivery kits help mothers to properly care for their babies outside the clinic.
Previously, patients brought newborn babies wrapped in dirty clothes, which was unhygienic. Now the kits have hygienic sheets and clothes, and they wrap the baby in it after cleaning. We are also giving messages to them to keep the baby clean like this.
Mothers like Sakina can bring their newborns home knowing that she and her baby will continue to be healthy.
My elder children were born in difficulties. Now it's not so tough as we go to the hospital. They take care of us. There are doctors available, there's cleanliness, and they provide clothes. My case has been handled well. Previously, it wasn't so easy.
In Sindh province, children play games and at the same time learn how to keep themselves safe. The government of Japan has contributed $1.5 million to programs, including 3 in flood-affected provinces, which focus on preventing and responding to violence against children.
Our work focuses on helping children who have been traumatized by the ravages of the floods. We provide games and activities in a mobile van funded by Japan. It helps to restore a sense of normalcy in their lives.
At the same time the government of Japan has been responding to immediate emergency needs, it has also not forgotten an older enemy, polio. The crippling and sometimes deadly disease is on the rise in Pakistan. Cases in the first 5 months of 2011 were double that of the same period last year, and children are most at risk.
She had severe fever. We visited a hospital where we learned that our daughter was suffering from polio. They provided a brace for her. Our message to all parents is to have your children vaccinated.
The government of Japan is supporting the Pakistani government, UNICEF and other partners as they work tirelessly to eradicate polio. Japanese support, more than $4.8 million in 2010 alone, is providing vital funds for vaccines and for communications that encourage parents to vaccinate their children. This support is helping to meet children's fundamental rights to survival and health. Japan's dedication to the most vulnerable in Pakistan is both improving and saving lives, and shows that the people of Pakistan, in their greatest hour of need, are not alone. Whether it's providing clean water, child protection services, newborn care or vaccinations, ongoing support for Pakistan is critical as children and their families struggle to rebuild lives devastated by forces beyond their control.